Hello everyone, my name is Anita. I work with WomenLift Uganda as the private sector engagement manager. I have been part of the Thematic cohort 2024, and my project is titled Empowering Junior Women Leaders to Make Evidence-Based Decisions for Improved Contraceptive Uptake in Uganda. This project will be piloted in WomenLift Uganda, where we have a team of junior women leaders that implement family planning projects in the country. They include outreach team leaders, regional training officers, regional clinic managers, and family planning for persons. Their roles are data collection and reporting, performance management, training and capacity buildings for nurses and midwives in private and public health sector. And according to UDHS 2022, modern prevalence increased slightly from 35% in 2016 to only 37% by 2022, while unmet need is at 22%. Lack of skills in use of data to make decisions affect service delivery, resource allocation, and accountability. This project aims at empowering these leaders with the necessary skills and knowledge to improve family planning uptake in Uganda. Key project interventions are conducting a needs assessment to understand the data literacy levels amongst leaders, identify the challenges related to data, but also be able to identify the training needs for these leaders. Capacity building and training on use of health data, mentorship and peer learning, impact monitoring and evaluation. The expected outcomes at the end of the project are data utilization to guide decisions so that family planning projects are only implemented in places where they are needed most, enhanced decision-making that is driven by data, stronger leadership skills through confidence building of these leaders, and also having empowered women leaders that can ably compete for higher leadership roles in the family planning space. Along that journey, implementation did not happen as expected. There was a shift in organization priorities because we are undergoing a restructuring. We lost a number of targeted junior women leaders, and also there was a lot of low merging, which also increased workloads that disrupted mentorship schedules. However, I had the following achievements. I was able to regroup a cohort of 10 junior women leaders. We conducted and completed a needs assessment. We also re-engaged senior management and got their buy-in and support to continue implementing the project, and therefore was able to hold one mentorship session. The next steps to maintain momentum is to establish peer support groups where these junior women leaders can share experiences, challenges, and best practices, and also continue impact monitoring and evaluation to track progress, but also for scalability plans. This journey has impacted on me as I was being able to embrace inclusivity in my leadership, and this has enabled my team to have an enabling environment that has enhanced them to thrive. I've also rediscovered myself and been able to understand my weaknesses and strengths, and therefore I'm very intentional when I'm identifying relationships, and also I've been able to build strong and meaningful relationships. I've impacted on a number of ladies in the past 1 year through motivating them to push for a better version of themselves and empowering them to achieve their full potential through mentorship and peer-to-peer support. As I end, I will give the quote by Jim Rohn, which says, "You cannot make progress without making decisions." I've therefore decided to become a mentor who supports other women become competent and confident to take on higher leadership roles in the family planning space and other sectors. I thank you very much for listening to me.